human trafficking in their communities. That's why I helped secure a 5% set aside from the National Crime Victims Fund to help tribes with prevention and victim support. And I introduced the Survive Act to make this funding permanent because it's critically important that tribes have access to this funding without having to battle for it every single year. The Government Accountability Office recently confirmed that it would be moving forward with my request to conduct a full review of how federal agencies respond to reports of missing Native Americans and recommend solutions based on their findings, giving us even more insight on how to move forward. It's the organizations like NACUI that have helped bring national attention to the MMIW crisis, and we truly wouldn't have come this far without your help. But we still have so far to go, and Congress needs to act faster. So keep up the pressure and keep holding your elected officials accountable. And I'll keep fighting to end the MMIW crisis from the U.S. Senate. Thanks again for inviting me to give remarks. I look forward to continuing our work together. Also, I'm told attached to this, you will be able to download a one-pager from the senator and a letter included. Moving on to Senator Catherine Cortez Masto, remarks from her. As all of you know from the stories you've shared and the research you've engaged in, Native American women face a profound crisis. Your work has raised a clarion call for action to protect the 84% of Native American women who face violence in their lifetimes. That's why I continue to fight every day to pass 3 key pieces of legislation in the United States Senate. First, I'm working to get the data we so desperately need to understand the scale and shape of this problem. I've co-sponsored Savannah's Act to get tribes better access to federal databases that track crimes. The act would also require the federal government to consult with tribes to develop guidelines for federal, state, and local law enforcement to keep Native women safe. Second, I want the federal government to do a better job of coordinating efforts to address violence in tribal communities. To that end, I've introduced the Not Invisible Act, which creates an advisory committee made up of tribal, state, and local law enforcement, service providers, representatives of federal agencies, tribal leaders, and survivors and family members that will recommend new approaches to reporting, data sharing, and prosecution. Finally, I believe in granting tribes the power to go after perpetrators of violence that all other communities in America have. I'm a strong supporter of reauthorizing the Violence Against Women Act with updated provisions to help tribes prosecute rapists, stalkers, and those who harm women, children, and law enforcement officers on tribal lands. I'm proud to stand with community leaders and advocates who take part in this virtual dialogue. You all have been instrumental in raising awareness about the dangers facing Native women and girls today. Together, we can keep them safe. Moving on to Congressman Dan Newhouse. Words from the Congressman. Native American and Alaskan Native women throughout the country face a murder rate 10 times higher than the national average, with 84% experiencing some kind of violence in their lifetime. In my home state of Washington, Native Americans make up about 2% of the population, but a recent report by the Washington State Patrol shows that Indigenous women account for 7% of the state's reported missing women. My congressional district in central Washington sits at the epicenter of this crisis. In the past 5 years alone, 7 women have been murdered or have gone missing on or near the Yakama Nation reservation. In just last week, our community was given another horrible reminder of the pervasiveness of the missing and murdered Indigenous women crisis when it was reported that the remains of Rosenda Strong were found in the city of Toppenish 275 days after her disappearance. Rosenda's unsolved murder is just one of the 71 open MMIW cases in Washington state, 31 of them occurring in my congressional district. The response of the local community to this crisis has been commendable. Tribal and community leaders have held multiple rallies and community forums to raise awareness and demand action. The diligent reporting of the Yakima Herald Republic has highlighted the community's response and activism on the ground by creating an online hub to list open cases involving missing and murdered women and providing resources for the community to report disappearances. Recently passed state laws in Olympia have enhanced data collection and improved communication between tribal leaders and various state agencies. I applaud these efforts, and I am inspired by the progress being made at the local and state level. However, this is a national problem that requires a national response. That is why I, along with my colleagues, Representatives Torres and Holland, introduced Savannah's Act. Our legislation aims to address and bring awareness to the crisis of missing and murdered Indigenous women at the federal level by improving coordination between federal, state, local, and tribal law enforcement agencies. The bill would develop guidelines and best practices for tribes and law enforcement agencies across the country to enhance the reporting and record keeping of crimes against Indigenous women and improve communication between law enforcement and families of victims. The bill is named in honor of Savannah LaFonte Greywind, a 22-year-old member of the Spirit Lake tribe, pregnant with her first child, who was murdered in August 2017. Her murder brought long overdue national attention to missing and murdered Indigenous women. Thankfully, justice was served upon Savannah's murderers. We owe the same justice to Rosenda and many other murdered and missing Indigenous women across the country. I will continue to be a vocal advocate for those who have lost and for solutions, for those we have lost and for solutions to end the status quo that is failing our communities and endangering yet another generation of Indigenous women. Savannah's Act is an important first step to addressing this crisis.
Thank you, Carla. So now we're going to move on and thank you for all the congressional people who sent in their remarks, and I've noticed that some of that data is from the Urban Indian Health Institute, so that's been phenomenal. They've made such great headway in making sure that data goes into the hands of lawmakers who can make a difference, so that's wonderful. So I have the pleasure of introducing Jeannie Hovland. NACUI is pleased to be collaborating with the Administration of Native Americans on this national dialogue, so I'm delighted to introduce her. As she holds several roles, I will briefly share and ask that she add to the scope of her responsibilities during her presentation. Commissioner Jeannie Hovland was confirmed by the Senate in June 2018 and oversees the Administration for Native Americans discretionary funding programs for American Indians, Alaska Natives, Native Hawaiians, and Pacific Islanders. She serves in a dual role of Deputy Assistant Secretary for Native American Affairs, affirming the government-to-government relationship with Indian tribes. Equally important to today's conversation is Commissioner Hovland's role as the chair of the HHS Interdepartmental Council on Native American Affairs. We know that the council has prioritized issues on missing and murdered Indigenous people in its work, and NACUI is proud that today's dialogue will inform that work. Commissioner Hovland is an enrolled member of the Flandreau Santee Sioux tribe of South Dakota, and among her most cherished responsibilities is serving as an advocate for all Native people. She understands the challenges faced by Natives who reside in urban settings, and NACUI is committed to working with her, ANA, and other partners to make a real difference for Indigenous women, men, and children. And I would just like to thank her also for her leadership in getting that that council restarted. Her alongside with the IHS director have been instrumental in getting that Interdepartmental Council of Native American Affairs back up. And so, Jeannie, if the floor is yours.
Oh, thank you so much. Thank you for your kind introduction, Frances. Before I proceed, I want to make sure you can hear me okay.
Thank you.
All right, thank you. And Petu Washte Koda, Chante Washte, and Apechu Zapishto. Good afternoon, my friends. I greet you with a good heart. As we know, there is an important need to address economic and social well-being of Native American children, families, and individuals who live in urban settings. I myself have been an urban Native my whole life. That is why I'm pleased that NACUI and ANA work together to hold this virtual dialogue with urban Indian organizations on murdered and missing Indigenous women. I would like to add a welcome to all who have joined this conversation to address this issue that affects many of us professionally and personally. The tragedy of murdered or missing Indigenous women, as well as children and men, is not new. And thanks to the unrelenting work of tribal leaders and Native advocates over the years, including federal agencies, legislators, organizations such as Urban Indian Health Institute and others, finally there is growing recognition of this problem. But as stated in some of the letters, we cannot stop now. We need to improve our understanding of the extent of this problem and build greater awareness. We need to proactively address the health and social well-being of Native people and support interventions that prevent harm and death. This is not a responsibility that should be left to just tribal leaders, advocates, urban Indian leaders, and a few organizations. It is going to take all of us working together to make a difference in the lives of Native people and communities. I appreciated Francis's overview of today's conversation, and I want to underscore that urban Indian organizations across the country who are on the front lines have an important role to play in our collective efforts to address issues that contribute to missing or murdered Indigenous people. I also want to be clear that when we speak about the enormity of this issue, it includes the impact on the children, aunties, grandmas, and other relatives, as well as members of the community who are connected to the person who is missing or murdered. The tragedy of missing and murdered Indigenous women is about real people, and to express the depth of the problem, I received permission to share a brief story. Sonia's son was murdered when he was 30 years old. He was a custodial parent of his 3 young children at the time of his death. Overnight, Sonia went from being a grandma to the caretaker of her grandchildren. Beyond the pain of a personal loss, she was confronted with the behavioral health needs of the children, one who began cutting herself following her dad's death. Not only were there significant changes for Sonia and her grandchildren, there were economic problems, instability, and frustration with health and social service systems that were disconnected and offered limited support. Okay, sorry. Sonia's here in the room with me, and she's one of my colleagues, and I have so much admiration and respect for her. So thank you, Sonia. All right, and now I get emotional. As commissioner, I hold multiple roles within the Department of Health and Human Services, and I'm using all options available to address the issues that contribute to the problems of missing or murdered Indigenous people. As a commissioner of ANA, I oversee discretionary programs that benefit American Indians, Alaska Natives, Native Hawaiians, and Pacific Islanders. This position allows me to serve as an advocate to Native peoples across the department and the executive branch. As the Deputy Assistant Secretary for Native American Affairs, I work with senior leaders of programs within ACF, which is the Administration for Children and Families, such as Tribal TANF, Head Start, foster care, runaway and homeless youth, among others, that address vulnerable populations who may fall victim to human trafficking or who may be missing or murdered. Finally, as Francis had mentioned, as chair of the HHS Interdepartmental Council on Native American Affairs, I am responsible for the coordination of HHS efforts to improve the well-being of Native Americans. I'm grateful that Rear Admiral Riaki, the acting IHS director, who is the vice chair of ICNA, has been a strong supporter of helping me get this re-energized and reactivated. The members of ICNA include all of the agencies within HHS, which includes HRSA, SAMHSA, CDC, IHS, ACF, CMS, and others. Human trafficking and murdered and missing Indigenous women are a top priority for the ICNA. This means that working together, HHS agencies will be able to combat the issues of substance abuse, homelessness and housing, and a range of other issues that contribute to problems in our communities. I've had the opportunity to participate in listening sessions on reclaiming Native communities with the Assistant Secretary for Indian Affairs, Tara Sweeney, and other federal partners. And I've been able to participate in several consultations and roundtables on human trafficking and MMIW issues in California, Washington State, Hawaii, Guam, and Saipan. Input from these upcoming sessions will guide ICNA planning and coordination among HHS agencies to more effectively address these issues. I'd like to briefly share examples of work that is occurring at ACF before hearing your thoughts on the resources that are needed to fill gaps in urban Indian communities, build necessary capacity, and support additional engagement. ANA oversees different grant programs that, among other things, promote social and economic self-sufficiency in communities. One flexible funding stream is a social and economic development program which supports locally determined projects designed to reduce or eliminate community problems and achieve community goals. ANA also collaborates extensively with the ACF Office of Trafficking in Persons, or OTIP, and together we have developed a Native Youth Toolkit on human trafficking, which is available on ANA's website. The toolkit helps youth understand what human trafficking is, provides tips for protecting themselves from being trafficked, ways to fight trafficking in their communities, and resources they can use. OTIP also oversees the National Human Trafficking Training and Technical Assistance Center that provides capacity building support to communities to identify and respond to the complex needs of individuals who have experienced trafficking. Also, the ACF Family Violence Prevention and Services Program Act funds the federal response system, which ensures that crisis services are available to individuals experiencing domestic or dating violence and their dependents. Supported efforts focus on increasing awareness of primary prevention of domestic and dating violence, providing immediate shelter and supportive services, operating a national domestic violence hotline, providing technical assistance and training relating to domestic and dating violence. It also funds the National Indigenous Women's Resource Center, which supports national training and technical assistance, public awareness, and policy and research development. It funds Strong Hearts Native Helpline, which you can find at strongheartshelpline.org. And this is the first national helpline for Native people experiencing domestic or dating violence. It funds Alaska Natives Women Resource Center, which improves services to Alaska Native people experiencing domestic violence. I believe we have the resources on a slide. So at this point, I would like to hear your thoughts about the resources and collaborations that are needed on the following questions. How can we fill program gaps for urban Indians? Build necessary capacity within local programs and support additional engagement with urban settings.
So I don't need to use this one, right? This is July 3rd, It's yours.
The first question is up and available for you to fill in. And that question is, what resources and collaboration are needed to fill program gaps for urban Indians? You can please take time to respond to that now.
Quick reminder for folks on the line, please mute your lines. Thank you.
Mute my line. Mute mine. Can you hear me?
Oh, yep, we can hear you.
Uh-oh. Okay.
I think we're going to wait just a little bit, few seconds more for you to answer the first question. We have some answers, 7, more funding for technical assistance on identifying and responding to this issue. Emergency and long-term housing, that's something that I hear, and I heard at, where was I just at, Spokane from our tribe. I like the toolkit in developing others specific to needs we have in our areas. Having resources to fund education. These are all very good. Prevention programs for youth. Oops, it moved. Youth, women, and men. homelessness resources, funding always. Invest in direct services, gender-based violence, homelessness, SUD, anybody know what that means? What is it? Substance use disorder? Okay, thank you. Expand research for urban Indian areas throughout urban Indian health. So I wonder if it would be helpful, I suppose I should never assume that we all know where all these funding resources are, since there are so many different of them and then some are phased in and out. If we develop a resource center, unless there already is one. So it's something to think about. I just added another question, I guess. Do we want to move on to the next question? Okay, our next question, if you can fill in for question 2, what resources and collaborations are needed to build necessary capacity within local programs? You can go ahead and take a few minutes to pause to that. I mean, to answer that, I'll pause. We didn't hear that.
That's recovered, but it's like, I still feel like Diane Rob might have to play a role because it's at level 5 or something. So something's going on. Yeah, choose me. I said call Miko because I'm on this call. Great. Sorry. Yeah, okay.
We can hear you, by the way, just FYI. So far we have a couple of responses. Please continue to answer while I start reading some of them. Intradepartmental collaboration, absolutely. IHS SAMHSA, DOJ. The other agency that was asked to be part of this conversation by our tribes was HUD, again because of the housing, as well as the VA for our Native veterans and our female veterans. Strong local referrals to address a variety of needs. Oh, I like this. When a one-stop shop is not available, we need to get a one-stop shop. All right, one-stop shops. Local shelters, law enforcement advocates referring to urban Indian center programs. These are all very good. The best model for collaboration and research, policy, and programs. Something similar to SAMHSA's Strategic Prevention Framework Grant. You know, I should mention, as you're all writing your questions, some of you may know this, but not everybody. I'm sure everybody knows Ms. Mirtha Beadle, who has done amazing work at SAMHSA. She has recently joined Team ANA. She's over here at the Administration for Native Americans. I'm so happy to have her here. She's in the room, and she helped collaborate and get this set up with Francis today. So I think she's reached out to most of you. If not, let us know, and we'll get you her contact. I'm so grateful and blessed to have her on board with us here. Okay, access to data. Clearly defined identification. I think I talked about that. Sharing data, which is why it's so important to have Department of Justice and the Department of Interior. I can report that I have a great and strong working relationship with the Department of Interior Assistant Secretary Sweeney, and we are working to engage more with the Department of Justice on this specific issue. The UIOs need to be funded at higher level, expanded access in more urban areas, bring together all the resources with easier access. I agree. Funding for personnel, collaboration with local law enforcement, domestic violence shelters, hospitals. Legislation allocation for HHS services, TA, technical assistance, all excellent. Evidence-based screening tools for our population. More for MMIW, we do have, in collaboration with the Office of Trafficking in Persons, ANA, will be, and Office of Trafficking Person will be, we will be publishing SOAR Native, which is currently it's SOAR, which is free online or in-person training for professionals who see victims of sexual assault and human trafficking. It helps professionals, whether they're social workers, medical practitioners, the frontline folks that see victims, to be able to help them identify and not only assist with their situation, but also to help us be able better to identify victims. And so we are working with OTIP to bring it, make it more culturally appropriate. It is accredited, and we will have that available this fall. All right. We're going to go ahead and move on to question 3, which is support additional engagement within urban settings. Please take some time to give us your input on that. How can we support additional engagement within urban settings? Oops. What resources and collaboration are needed to support additional engagement? So again, what resources and collaboration are needed to support additional engagement within urban settings? All right, keep bringing those answers in. We have 3 so far, 4. Thank you. Let's see, what resources and collaborations are needed to support additional engagement with urban settings? What are you trying to gain from this question? This question, okay. What resources and collaboration are needed to support additional engagement within urban settings? So what do we need to do to get more engagement within the setting? What are some barriers? What are some things we can do, like coordination between service providers? All right. And I know my goal here at ANA is we want to make sure, and we are by law to be an effective advocate for all Native Americans, which includes our urban Native population. So I feel oftentimes our urban Native populations and organizations are either left out or asked to get involved later in the game. I could be wrong. That was just kind of my experience when I worked in the Dakotas. So I just want to make sure that as commissioner, when we're addressing issues pertaining to Native Americans, that our urban Indian citizens and organizations have a seat at the table. So that, I hope that helps clarifying kind of what we want to gain out of this. Urban confer policies, here are some of the questions. Feel free if you need a few minutes to think about this. Connection, urban and state. Oops.
Joining the
I just want to acknowledge that we are getting comments from folks on YouTube, and we are looking at your comments, and we thank you for participating and for the comments that you are providing. We have one from Candy, creating a national database system for all to collaborate together and share our programming and resources, and I would add to that best practices also, thank you. I don't know if there's a question, is there a current accurate database available regionally? Not to my knowledge. There might be somebody on the phone that knows otherwise, or on YouTube. Back to question number 3, some of the other Native survivor advocates, thank you. Let's see here, have federal agencies work with an urban Indian Health Institute directly. Safe places for dialogue of families, survivors, and community members, excellent. Again, a lot of feedback I heard attending HHS regional consultations was we need to remember the families and the communities because it has such a devastating effect on both. HB 25-7 passed in Arizona. Wonderful. It is creating a statewide task force to study and gather data on murdered Indigenous women. I'm so glad there's momentum out there. We need to continue it on. Educating legislators and policymakers in Indian country on sovereignty, treaties, and jurisdiction. Excellent. Okay, I need to move. I'm sorry if I'm taking up a lot of time. I hope this is the first of many dialogue that we have going forward. Thank you, everybody. We will keep track of all of the comments and make sure that we look at every one of them and evaluate and use them in decision making. So thank you very much. Your input is very important. I need to move on and let our next speaker go ahead and give her presentation. I'm going to do a couple of introductions. I appreciate the collaboration with state and federal partners whose work and programs are essential to responding to this issue. Also with us today, we have Representative Mary Kunesh Podine, Assistant Majority Leader in the Minnesota House of Representatives. Mary is an enrolled member of the Standing Rock Sioux Tribe. She was first elected to the Minnesota House of Representatives in 2016 and was one out of 4 Native American members of the Minnesota legislature in her first term. She serves as Assistant Majority Leader and is the author of a bill to create the Missing and Murdered Indigenous Women Task Force in Minnesota and require an annual report on issues related to violence against Indigenous women and girls. We also have Rose Wiahi, PhD, and Acting Director of the Office of Urban Indian Health Program. Dr. Rose Wiahi is a member of the Navajo Nation and serves as the Acting Director of the Office of Urban Indian Health Programs at the Indian Health Service. She provides oversight of Title V of the Indian Healthcare Improvement Act and healthcare services provided to American Indian and Alaska Native beneficiaries who reside in urban areas across the nation. She previously served as the Director of Field Operations for the Phoenix Area IHS and as Director for the IHS Division of Behavioral Health. Also joining us is Christine Crossland, Senior Social Science Analyst for the Violence Against Indian Women. Ms. Crossland is responsible for planning, implementing, directing, evaluating, managing, and reporting on social and behavioral research grants, cooperative agreements, contracts, and studies funded by the Department of Justice. She directs research addressing American Indian and Alaska Native crime and justice issues. She also is the Director of American Indian and Alaska Native Violence Prevention Research Program, which is specifically designed to examine violence experienced by American Indian and Alaska Native women. Also joining us is Sherry Ann Moore, Deputy Director of Tribal Affairs in the Office of Violence Against Women. Sherry Ann Moore is a member of the Rosebud Sichungu Lakota Tribe in South Dakota and is the Deputy Director of Tribal Affairs for the Department of Justice's Office on Violence Against Women. She provides federal leadership, national oversight, and guidance for policy development and management of OVW tribal affairs that pertain to Violence Against Women Act. Also is Jad Atala, Director of the Office of Performance and Planning, Office of Native Programs for HUD. Jad is the Director of Performance and Planning in the HUD Office of Native American Programs, and which administers several tribal housing and community development programs that provide hundreds of millions of dollars in annual block grants to Native American tribes annually. Welcome, everybody, and at this time, I'd like to hand it over to Representative Kunesh Kodin. Mary, are you able to join now? Representative Kunesh Kodin? I guess we're having some audio issues. Please bear with us.
Hello, can you hear me?
Hi, we can hear you.
Yes.
Hi, Miriam. Can you hear me now? This is Mary.
Yes, it's a little bit of background noise, but happy.
Okay, I'm sorry about that. I don't know. I thought I had this all set up just perfectly, and of course there's always something at the last minute. And I'm sorry, you want me just to introduce myself?
Yeah, we introduced you. Why don't you go ahead?
Okay. So yes, I am State Representative Kunesh Kodin, and 2 years ago I introduced a bill to create a task force here in Minnesota to study our missing and murdered Indigenous women's issue. I had listened to the preliminary reports coming out of Canada on their report, and I know that they were not happy, that the Indigenous community was not happy with the results that were coming out. And it was about that time that Savannah Graylin went missing, and Heidi Heitkamp was going to create some legislation around that. I, as a new legislator, did not quite understand my role and what I could do, but when I went back to my office and said, what can we do about that, we put together a task force of what we thought would be the players, the best agencies and community members and programs that would support that. And then we took it to, actually to the women, the tribes throughout Minnesota. So we invited leaders and elders from our different tribes to come in and meet and talk about it. We had a number of folks on the phone from Greater Minnesota that chimed in on it. And they're really the ones that fine-tuned the bill. They were the ones that said, yes, we need this agency, no, we don't want that agency. This women's violence program should be included. We want survivors, we want family members, we want the gamut. So they're the ones that pretty much ran the writing of the task force. And we introduced it last session. We meet every year. So in 2018 we met as a legislature, and I introduced the legislation, and we got the first hearing, which would have died if we hadn't, on the very last day as the very last bill being heard, and it received unanimous support. Both sides, both Dems and Republicans were horrified and appalled, and really wanted to make sure that happened, but for whatever reason last year it didn't happen. And so this year I brought it back right away, and we moved it through our legislature. We're the only split legislature in the country. So we have our House of Representatives is a majority of Democrats, CFLers, and then the Senate is majority Republican, and we have a Democrat governor. So somehow or other, and with really almost 100% support through both of those pieces of legislator and the governor, we were able to pass this task force. And the task force, I think, is pretty comprehensive. It makes sure that we are looking for the data and to identify how we can help to support the different agencies as they're collecting it. So they're going to... Pardon? And so... Hello, am I supposed to be speaking yet? Hello?
Hi, Mary. We're having a really hard time understanding a lot of what you're saying.
I'm not sure what the problem is. We're kind of stormy in Minnesota, so I don't know what I can do here. Why don't you have somebody else speak and come back to me?
Oh, thank you, and I apologize. I appreciate that. Why don't we see if we can, Rose, Leonie, if you're on the line, do you want to do a sound check real quick?
Hello, everyone. Please be sure to mute your line if you're not talking. Thank you so much. We're going to go ahead and move on for the time being to Rose Biaki.
I'm sorry, this is Mary. Do you hear me better now?
Hi, Mary. Yes, we can.
Okay. So if you'd like, I'll just go back and redo what I was saying just very quickly so that the others can speak as well. But what I was explaining is that after hearing the report coming out of Canada and understanding the situation with Savannah Greywind up in North Dakota, she's our neighbor, it's our neighboring state, and going back into the legislature and getting the assistance I needed both from the Native community as well as my legislative resources, we were able to put together a really comprehensive bill that supports our missing and murdered Indigenous task force. It took me 2 years of legislation to pass that legislation, and we passed it with 100% bipartisan support. We are the only state in the union that has a split legislature, with the House members being majority Dem and the Senate the majority Republican with a Democrat governor. So in spite of all of those issues, we were able to pass this task force within 2 years of it first being introduced. And what we're really looking for is to create a task force that's going to examine and report on issues and addressing the systematic causes, of course, behind the violence to Indigenous women. And it, first of all, is going to identify appropriate methods for tracking the data, because we all know that different agencies and different programs are tracking data or not tracking data, and the way they collect it, the way they present it might not be consistent across the board. We're going to be looking at government policies and institutions that impact violence against our Indigenous women. The task force is a 2-year task force, and at the end, we are hoping to have some really strong, tangible recommendations on appropriate measures, how we can address the violence. Minnesota, of course, borders the Great Lakes, and there has always been an issue with sex trafficking. We also have the Mall of America, which is a huge indoor shopping mall, and sex trafficking is not unusual to be run out of there. And so we do have an issue, of course, with sex trafficking and it going internationally between Canada and out the lakes. And then we want to really find some intentional suggestions in ways to assist victims and the families. When we had our hearings, we heard some really sad stories of family members who lost a member who don't know where they were, or they were murdered atrociously and justice has not been served. One woman that was at every single one of our hearings was Misty Babineau, and she was assaulted for the very first time when she was just 9 years old by the boyfriend of her foster mom. And then when she was 12 years old, she witnessed both her grandmother and her mother murdered in front of her. And it was as she was trying to defend them that the attacker went after her. She has scars on her hands to show. And then again, this poor girl, when she was 20, she was kidnapped, taken 60 miles from her home, held against her will. She was raped, but she was able to get away. And she was absolutely insistent that she wanted to be a part of it, that she wanted to testify and tell her story, as painful as it was. And I think it's the stories, it's the human connection that really made a difference with our legislators. And there were women, there were family members lined up to testify. And I think that that human connection to our legislators really made all the difference and helped to make this task force legislation passage much more successful. And I'm done.
Thank you so much.
Hello?
Are there, and thank you. Can you hear me okay, Mary?
Hello?
So I don't think Mary can hear us. I hope everybody else can. But if you have any questions, please ask them now. Mary, are you able to hear us yet?
I can hear you now.
Thank you.
I can hear you now.
And
I can hear you now.
Thank you.
I can hear you now.
We have a lot of echo feedback. Thank you for your leadership in Minnesota on this very important issue and the work that you're doing and that you have done. If anybody has any questions, please ask them, either type them in or ask on the phone here. Feel free to speak up. We have a few questions. I haven't heard anybody speak up. If you're speaking up, you might be on mute. Here's a question for you from Esther and Abigail. I'm sorry. How can we ensure that urban Indians are included in legislation? And Mary, I don't know if you heard that. The question is, how can we ensure that urban Indians are included in legislation?
Are you there?
The question is, how can we ensure that urban Indians are included in legislation?
I would suggest that you reach out to different agencies and programs that deal with violence against women.
If you want to look at the chat, there are some questions, and if you want to answer put your response in, we can always come back and read those. and review them or you can review them and respond.
So are you able to hear me right now?
Now I can hear you, yes.
Okay. What I was saying is that it's important that legislators who are creating this legislation are reaching out to the community members and the programs and agencies that work with our Native communities. If there is a community center for Natives or an Indian center, those are really good places. And what happened with me is that when I connected with just a few of the women and the elders and the leaders, they certainly put the word out there. And it wasn't just the urban Indians that came and looking for ways to participate, but it was a statewide effort. And the issues that the urban Native community has are very similar to what we have up in the rural areas, and they have unique situations either. But we have so much movement between the urban and the rural communities. It was really important that we address both of them. And the other thing that really made the difference was when the women and the families would come in and talk directly to the legislators. Too many people had no idea that this is really happening. And when they heard the stories, they were appalled, and that really spurred the action.
Thank you. So making sure that we're engaging with tribal leadership so that they're advocating for the urban population as well as direct conversation with representatives and those policymakers.
Yes.
Yes. Another
yes.
question. Esther or Abigail, feel free to speak up at any time.
Hi, this is Abigail.
Was there another question that I should be answering here?
Hi, this is Abigail. Can you hear me?
I can. This is Jeannie.
Okay, just really quickly to clarify on our question, what we were asking is in regards when we look at both state
somebody said one of the questions was share what it took to put together the task force, and do you think that urban programs can be on the task force? What it took, well, what happened for me is that once I had the revelation that I needed to put together some kind of legislation to address it here in Minnesota, I went back to my to the Capitol, to my office at the legislature, and we have really great legislative researchers and a really great staff. And I tried to find out who would be the most likely researcher that could help me put together a task force. And we fortunately had a number of employees that had worked with tribes, were lawyers, were familiar with Indian law, were familiar with the situation here in Minnesota around violence against women and girls. And they helped craft the initial legislation. So it was sort of like the rough draft, the outline. And families found out about it. I contacted a few of the organizations in the Twin Cities and up in Duluth, Minnesota, that I knew were working with women who had experienced violence or who would know who to contact, and let them know I was putting this task force together, asked if they would be willing to meet with me and review the initial piece of legislation. And as I said, we probably had 24 women from across the state around a table one night, and at least a dozen on the phone. I'd sent the legislation to them ahead of time for them to review, and we went through it line by line, piece by piece, talking about who should do this, which agencies, which program, what are the problems. And we heard, that night I heard so many more stories. And in a way, I think there were many women there that did not know me, didn't quite understand what my role was in all of this. But by the end of the day, I think they were all very excited and really supportive of the effort to create this legislation. And so with that, we went through maybe 2 or 3 more renditions of the piece of legislation before I drafted it. And I just made sure that all of them were in agreement, that felt it was the best piece of legislation we could put together. We had to keep it very trim so that it didn't cost too money. We had to make sure that everybody was covered as far as coroners and sheriffs and the different jurisdictional police jurisdictional issues. And it was really this group of women that put this together, and I took it to the legislature.
Thank you so much. I appreciate your response. Can you hear me, Mary?
Hello?
I think.
Yes, we can.
Mary,
Are you able to hear me?
can you hear me?
Hello? Yeah.
Is this Mary?
Yeah.
Thank you for speaking, Mary. Appreciate it. We have questions we're going to follow up with you on. We still have technical issues, I think, being able to hear you and you hearing us. So we'll send you some questions and have you follow up. So thank you for your presentation today and again for your work.
Yes, I'm sorry that we're having those problems. There's so much to talk about.
Yes, I'm sorry too. And if you get a chance, you can look on the questions that have come up on chat that are on the computer. And I think we're going to move on to Rose Wiaki, but everybody still send your questions and we will follow up.
Thank you, everyone. And actually, we do have a presenter coming up on a timeline, and so we're actually going to move on to Linda Sunstone. And we'll come back to Rose Wiaki. Yeah.
Thank you.
Linda has been the NACUI secretary and has also been really adamant about human services such as human trafficking and homelessness. And so we really wanted to, this is supposed to be a dialogue, and so we're hoping to highlight programs and have other programs also talk about their services. And so Linda, with that, if we can, hopefully the sound's okay, would like to see your presentation. Thank you.
Can people hear me? Hello?
I can hear you, yes.
Go ahead. I was asked to do a presentation about, I was asked to do a brief presentation on some of the programs that we have that are related to the topic that we're discussing today. So I'll go through this fairly quickly because I think we're probably pressed for time. But anyway, the first slide here is information about our health center that we have 3 clinic locations, and we provide medical, dental, behavioral health, traditional healing, and we have an array of support services. But we also did receive funding through the Office of Victims of Crime for providing services to Native American women victims of sex trafficking. And then we received that funding in, I believe it was 2016, and then last year we received additional funding through OVC to provide comprehensive services to all victims of human trafficking. So we can go to the next slide. Okay, so I'm just going to give a very brief snapshot about human trafficking in New Mexico, just the data shows that it is increasing from, that's supposed to be, it says 2017, it's actually supposed to be 2013. From 2013 to, 2014 rather. So from 2014, the 70 cases were reported, and then in 2015, 90, and then in 2016, 118, and that's a 40% increase over a 2-year span. And that of course only covers those cases that are reported. There's reason to believe that these numbers significantly underestimate the true number of cases going on in the state. We don't have any records in New Mexico in terms of the actual number of Native American women victims of human trafficking. We do know from the data reports in Minnesota and Canada that showed 40% of their victims were Native American, even though they only made up 10% of the total population. Our state is strategically situated as a frequent location for traffickers in the Southwest because it's located between Mexico, California, and Arizona. Also, in our state, there's a high concentration of vulnerable, low-income, and uninsured minority populations, which in our previous discussions, that kind of ties into a lot of the risk factors for being a victim of human trafficking. And then we also have major highways and a lot of community events that are easy venues for harboring and trafficking victims from other states and tribal reservations. And then in New Mexico, Native American women face or experience many of the risk factors associated with being victims of human trafficking: high rates of poverty, unemployment, homelessness, trauma, sexual assault, domestic violence, other forms of violent victimization. So as I mentioned, in 2016, we did receive funding through OVC through Project Beacon to assist Native American and other victims of sex trafficking and to provide community education about the signs and symptoms of sex and human trafficking, the risk factors, and resources available. And our goal basically was to create a continuum of care of services to identify and assist victims by creating community collaborations to serve as a referral and support services in addition to our comprehensive service system. So this is a snapshot of our flyer. It's our EAST program. That's our Project Beacon program, and that EAST stands for Education and Advocacy Against Sex Trafficking. So this, I just included this as kind of a snapshot of what we distribute to throughout the community. This is just one of several of our brochures and handouts that we provide. And then just briefly wanted to share a little bit of our outcomes. Since we're in our 3rd year, this is a 3-year funded program, and so we're actually finishing up our last year. We do have some data that I wanted to just share briefly. So we over the 3 years, we have been able to establish a continuum of care and referral network. We work a lot with the New Mexico Attorney General's office, and there's about 10 programs that in Albuquerque that actually provide services to victims of human trafficking, and we partner with all of them. We also do serve on the state human trafficking task force. And so to date, we've assisted 23 victims, and we've helped them with their medical, dental, behavioral health, cultural, and other support services. We've also completed 18 community presentations with tribal communities, the Navajo Nation, other local organizations. We did 3 presentations at national conferences, including the CUI, the Administration for Children and Families Region 6, and the National Indian Nations Conference, to basically provide education about signs and symptoms of human trafficking, what the myths are, and the cultural and other risk factors that are unique to Native American women victims. We also do a fair amount of outreach, street outreach, and I think as our other presenters have discussed, homelessness is a really major factor, and so we do a lot of street outreach to try to identify women victims who are not being served, who may be interested in getting help. And we do a lot of the outreaches with a lot of our community partners. And so in terms of victim exploitation, 40% of the victims reported being victims of sexual sex trafficking, 12% domestic servitude, 8% commercial sex exploitation, 4% forced prostitution, 4% pornography, and 8% escort services, and 8% others. And the locations of the exploitations range from hotels, private residences, brothels, construction sites, streets, manufacturing sites, and residential group homes. Um, 60% of the victims were identified through our homeless and community outreaches. 78% of our victims were homeless, of which 20% were placed by East into transitional or permanent housing. 42% of the women victims received needed medical services. 60% received behavioral health services, of which 20% received substance abuse treatment. 33% were not insured and received Medicaid enrollment assistance. All of the victims received food assistance. 33% received legal and advocacy services, and 28% received transportation services. And then I just wanted to make a note that last year, or earlier this year, the Navajo Nation declared January as the Human Trafficking Awareness Month. Our challenges have been that, you know, we've had some challenges in terms of reaching a lot of our clients for follow-up, and a lot of it has to do with because they're homeless and they don't have a reliable telephone. So that's been a little bit challenging, but we fortunately have these community connections with a lot of the programs that are serving victims, and so we work with them, and if we need to reach somebody, sometimes they'll tell us that so-and-so is over here and they would like to have you provide the service. So that helps us finding them, but that is a challenge for us. And then for our youth victims, it's a challenge because the state of New Mexico has very few, almost no services for youth victims. The second program that we received through OBC is called CARES, and it stands for Caring to Achieve Resilience and Equality Among Survivors. And we applied for this funding really to expand and enhance our East services because we felt like there was, you know, such a significant need, and we wanted to also make sure that the program doesn't overlap with the same thing that East does. And so what we've done through this grant is we've established a legal partnership with New Mexico Legal Aid Services to provide on-site and outreach services to do legal victim screenings and assistance. This program also serves all victims of human trafficking and also does focus on youth. The Project Beacon really focuses on adults, and to date, this program has assisted 20 victims, including youth. And so I just wanted to end with some client success stories just to show how our program has assisted victims. So we've, you know, I think if you want, I could read it or people can read this, but basically one of the priorities for a lot of the victims is to get them sheltered. That is really a really important starting point. And so a lot of our efforts are used to either place them in a motel or a safe house and then arrange longer-term housing. Through our CARES program, we have arranged more, permanent housing for 3 of our victims. So we've had a lot of our community partners make referrals, and as I said, through our street outreaches, and then friends referring their friends to our program. So the first success story, we helped this, the woman receive primary care, dental, behavioral health services, and also helped her with legal services and to obtain an ID. She was also uninsured at the time, so we did enroll her in Medicaid, which she really wanted to get coverage because she was on hormone replacement medications. We are finding that the LGBTQ community is a very high-risk population that overlaps with human trafficking and sex trafficking victims. The second case has to do with an individual who was referred by a friend, and she was homeless at the time and was staying at various hotels, and she came to us saying she was trying to get herself back on her feet, but she had all of her belongings stolen. So we put her up in a motel and then eventually got her into a safe house and provided her with food and transportation services to help her with her motel stay. And we are planning to continue to assist her with other services. But these are kind of two examples of how we've our East program has assisted our clients. I don't know if people have any questions.
Thank you so much, Linda. We'll take a second to see if there are any questions, and then I know, Linda, you have to go, and so I know. Thank you so much for being able to present today. And so we'll give a minute, and then if there's anything, you can also email us, and we can link you with Linda as well. Okay. Well, thank you so much, Linda.
Okay, thank you.
Oh, is this so? Thank you. Our next presenter is Rose Wiaki from the Office of Urban Indian Health, from the Indian Health Service. Rose?
Hi, I hope you can hear me okay. Hello?
I can hear you.
Yes, we can hear you.
Yes, we can hear you.
All right. Hi, this is Rose. I'm sorry, I just want to make sure that everyone could hear me okay. I wasn't sure if I was muted from the system, or I don't want to be talking to myself like I normally do. So thank you, everybody, for the invitation to talk about some of the IHS efforts in addressing this issue. I did want to mention that we may have other IHS staff from our Office of Clinical and Preventive Services Division of Behavioral Health on the line, which is the office and division that has oversight of the programs that I'll be speaking to you about today. And so I'll go ahead and get started. I know we have some other federal partners on the line, so I just wanted to give a brief agency overview. So the Indian Health Service, as a healthcare delivery agency, for the mission of the IHS is to raise the physical, mental, social, and spiritual health of American Indians and Alaska Natives to the highest level. And so as part of our Indian healthcare system, we have not only our IHS federally operated facilities, but we have our tribally operated facilities, and of course our urban Indian partners who operate the healthcare services in urban centers, which Francis spoke a little bit more about earlier. So for the Indian Health Service, we continue to focus on addressing the underlying public health issues that contribute to the high rates of violence and trauma. So this includes intimate partner violence, sexual assault, human trafficking, child maltreatment, substance abuse, historical trauma. And so through our Indian Health Service programs, and specifically the IHS Tribal Forensic Healthcare Program, we've been able to provide forensic health examiner training to about 1,500 examiners since 2012 in one or more of the course tracks, which have included adult and adolescent sexual assault examination, pediatric sexual assault examination, or intimate partner violence examination tracks. We do have an Indian Health Service policy that requires annual training of our healthcare providers on intimate partner violence screening and intervention. This intimate partner violence screening measure or rate is monitored annually through our GPRA, or the Government Performance and Results Act. So I know that we've been looking specifically at the urban Indian organizations screening rates, and although the goal for the agency is 41.6%, urban Indian organizations are at 10% screening rate, so certainly want to partner with NACUI and urban Indian organizations to improve those screening rates. We do have intimate partner violence screening and intervention that are routinely provided to patients that are aged 14 and above, although there are services that are extended to younger patients that disclose abuse. Through our program, the IHS and tribally operated programs offer 33 forensic healthcare programs, which provide direct access to forensic health exams and treatment. And again, this includes the adult and adolescent sexual assault exams, pediatric forensic sexual abuse exams, and intimate partner violence exams as well. The IHS policy also requires that all IHS federally operated health care facilities have policies and procedures that either offer the forensic health exams on-site or support referrals to outside agencies in order to provide a forensic exam. As part of our system, we have 12 youth regional treatment centers that focus on substance abuse and co-occurring mental health disorders. And so intimate partner violence screenings and intervention are routinely provided to those patients that are aged 14 and above at these centers. The Indian Health Service Domestic Violence Prevention Program currently funds 83 federal awards and also tribal and urban grantees with about $11.2 million annually. These programs are funded under two purpose areas that include one, community outreach and advocacy, or two, forensic health care. Many of these programs have hosted murdered and missing Indigenous women awareness events and have also provided case management support to clients reporting domestic and or sexual violence. And then in addition to that, various trainings and webinars have also been offered to share information on the use of the publicly available nationwide database of missing persons. So as healthcare agencies under the Indian health system, we did not necessarily fund directly search efforts or awareness campaigns for individual patients, but all IHS federally operated facilities do participate in sexual assault, child maltreatment, and intimate partner violence community response teams, and may become aware of missing or murdered patients, and in those instances, outreach to a patient's family to offer services such as grief counseling may be provided. There are no IHS federally, tribally, or urban operated facilities that perform autopsies, so this function is carried out by the state coroner offices or state crime labs. IHS facilities may or may not get notification of a death or an autopsy report depending on what the patient's relationship with the facility was at the time of death. Related to human trafficking education, the IHS, through a contract with the International Association of Forensic Nurses, does offer a recorded course on human trafficking in tribal communities. IHS leadership also encourages all healthcare providers to complete the SOAR for Healthcare Provider course offered by the Department of Health and Human Services. And I think Ms. Hovland mentioned this briefly in her remarks as well, that in the fall of 2019, we're anticipating the release of SOAR for Native communities, which is a human trafficking course specifically for healthcare providers working with Native populations. And so once that training is released, the course will be the IHS recommended mode of training for healthcare providers on human trafficking. So in summary, just want to say that it's important for IHS to partner with other agencies at the local, state, and federal level to offer support so that our Indian healthcare system can provide effective and culturally appropriate services to survivors of domestic and sexual violence. Through our IHS Domestic Violence and Prevention Program, Indian Health Services is providing support to the Indian healthcare system for increased victim services to the families and community members that are impacted by murdered and missing Indigenous women. In addition to that, IHS has a role to play in providing training to our healthcare providers on domestic and dating violence, on sexual assault, stalking, sex trafficking, trauma, historical trauma. We have a role to play in sharing best practices for prevention and intervention, and we have a role to play to ensure that the information that we capture through our health information technology system or electronic health record is able to capture accurate information such as intimate partner violence screenings. So IHS with our tribal and urban partners can and will continue to work towards increasing our capacity to respond to violence against women and work towards providing safety, accountability, and transparency across our system, and to bring awareness and visibility to this crisis. We can also contribute by improving access to quality healthcare services to address all aspects of health, including the physical, emotional, mental, and spiritual health and wellness. We can contribute by addressing social determinants of health, and also ensuring that we focus on the resilience and strength of Native people as well. So with that said, I do want to thank you for time for allowing me to share some of what the Indian Health Service is doing, and certainly look forward to partnering with all of you more moving forward to improve and increase our efforts in this area. And I didn't have a poll question, but I'm open to answering any questions that you might have at this point.
Rose, we actually created a poll question for you. So on the screen, folks should see what resources do you all need from IHS to fill the critical service delivery gaps and prevent the risk factors leading to MMIW in your community. I'm going to take a few minutes to provide a response to that, and then in the effort of time, we're going to not spend too long on this and make sure that we can get to our other presenters. We'll give it a couple of minutes on the screen. Thank you.
Hello, this is Valora. Can you hear me? Hello?
Yes, we can.
Hello?
Yes.
Hello?
We can hear you.
Can you hear me? This is Valora. Okay, great. I have a question for Rose. Rose, this is Valora. I'm Ms. Nakin Hoya. I'm the study director for our Arizona HB 2570 on the study of missing and murdered. I'm asking because I haven't been able to reach anybody at our Phoenix IHS, but could you recommend somebody who we can speak to include on our committee?
And this is, I'm having a hard time hearing, sorry, is that in the Phoenix area Indian Health Service?
Yes.
Okay, yes, certainly. Of course, the area urban coordinator, Taryn Watson there, also the director for behavioral health, Derek Patton, but you can certainly reach out to me directly. I can provide their contact information for you, or if you want to type in your contact information here in the chat box, I can get that from Nikui and follow up with you directly. But yes, I do want to say that each of our IHS areas do have points of contact for behavioral health and our area urban coordinators. And so if you need to reach someone or find a contact at your particular area office, or perhaps the service units or federal facilities near your locations, don't hesitate to reach out to me, and we can definitely connect you with the right person.
Great, I appreciate it. I'm going to put my email address in the chat box.
Thank you, Rose. And in the effort of time, I'm just going to go ahead and move the poll over to the right so folks can still continue to provide responses there. Thank you.
Are there any other questions for Rose? Okay, well, thank you. And thank you so much, Rose, for all that you are doing for urban Indian organizations and to build the capacity there. And thank you for sharing that information. And if you all, need to reach out to her, please email us and we'll get you in contact. So next we will turn it over to the Department of Justice, Christine Crossland.
Good afternoon, everyone. I just want to make sure you can hear me. I'm very honored to be part of today's discussion, and I'm grateful for your invitation and opportunity to provide information on this important topic of federal agency response to missing and murdered Indigenous women, and to help bring awareness to important resources available to communities and organizations. These issues are very important and something my organization within the Department of Justice has been grappling with for some time, especially as it pertains to identifying barriers to reporting and investigating missing person cases and finding viable and effective solutions. At the National Institute of Justice, We're the research development and evaluation arm of the department. And ultimately, we're dedicated to improving knowledge and understanding as it pertains to crime and justice issues, as well as public safety and wellness issues through science. And missing persons is definitely a public safety and wellness issue. Every year, over 600,000 individuals are reported missing to law enforcement. Fortunately, many of those people are quickly found alive and well. However, on any given day, there are between 80,000 and 90,000 active missing person cases, as recorded by the National Crime Information Center, also referred to as NCIC. These are staggering numbers, and it's the sheer volume of missing person cases that poses one of the greatest challenges to agencies tasked with locating missing persons. And for the families of the missing, it's a devastating time that some have described as a lonely and challenging journey. From a policy standpoint, it's important to note that there are laws in place requiring the reporting of missing children. However, there are no federal laws that require reporting and investigating missing adults, specifically individuals over the age of 21. Furthermore, every law enforcement agency has their own policies on how to handle missing adult person cases, to include when a report can be taken and how it will be investigated. And moreover, there is currently no federal law requiring law enforcement agencies to enter adult missing person cases into any national data system, although there is some proposed draft legislation, as we all know, under review that may change the status. As a result, we really don't know the extent of the problem with missing persons. And while there's no current federal law requiring reporting missing persons, I should note that there are some states that do require it, to include Arkansas, Illinois, Michigan, New Mexico, New York, Oklahoma, and Tennessee. And for those of you who are less familiar with data collected on missing persons, there are two primary national databases that collect this data. In addition to NCIC maintained by the Federal Bureau of Investigation, there is the National Missing and Unidentified Person System that my agency, NIJ, funds and administers with our partners at the University of North Texas Health Science Center. For those unfamiliar, NamUs is a national centralized repository and resource center for missing person cases, as well as unidentified and unclaimed decedent records. NamUs is a unique system in that it brings together law enforcement, medical examiners, coroners, forensic experts, families, and the public to help resolve missing person cases. Due in part to the sheer volume, missing person cases are a tremendous challenge to law enforcement agencies across the nation. To assist these jurisdictions in addressing these types of cases and to maximize the use of forensic sciences in solving crimes, NIJ has made federal resources available to all law enforcement officials through NamUs to identify or match unidentified and unclaimed decedents, as well as to help solve missing person cases. The NamUs system provides criminal justice users a secure online system to store, share, and compare sensitive case information. And for law enforcement agencies, the NamUs system offers them the ability to search outside their jurisdiction by connecting with other law enforcement agencies, medical examiner and coroner offices, as well as family and the public. And consequently, this process allows for greater cooperation and coordination between federal, state, local, and tribal government agencies and the public, and it focuses equally on solving cases involving children, youth, and adults. And as mentioned, NamUs also has a public component that allows family members and other public stakeholders a mechanism to report cases and participate in the search for potential matches. As we all know, family and friends of the missing experience trauma that can be overwhelming. They're forced to navigate a complex environment, usually without guidance of how to find resources to help report and resolve cases. For most people, the whereabouts of their loved ones, regardless of the reason for disappearance, is based on concerns for person's safety and well-being. So with NamUs providing access to family members and the general public, we're able to provide those most impacted the ability to participate in the process. In addition to NamUs being a unique and comprehensive resource that harnesses technology, the forensic sciences, and people to help resolve these cases, NamUs provides resources and services at no cost. So what are some of these three types of services? First, the NamUs team has investigative support. This is especially important since most of the agencies across this nation are understaffed, underfunded, and overtasked. Currently, we have 9 regional program specialists, or what we refer to as RPSs, who serve as our front line. The RPSs are typically the first point of contact for agencies and family members who enter missing cases into the NamUs system. Our RPSs are stationed across the country, so they are closer to agencies and communities they serve, and they often travel within their regions to provide additional training on the NamUs system and resources. So if you enter a case into NamUs as a result of today's virtual discussion or any subsequent community action opportunity, your case will be assigned to a regional program specialist who covers the state or region where the person you entered into NamUs was last seen. These RPSs are also available to provide training to your community organization and assist in outreach efforts. The RPSs can also assist family members in obtaining official law enforcement reports for missing persons if it's not already done. Other important services that NamUs provides includes the use of our case management system for law enforcement agencies and others who can perform advanced searches using automated matching tools within the NamUs system to expedite case associations and resolutions. One of the many law enforcement agencies we have partnered with over time includes the Department of Interior's Bureau of Indian Affairs, where we have trained BIA staff to input missing person data into NamUs that come to their attention and that they are actively working to resolve. Because the BIA doesn't have a system to collect this type of data, NamUs is now able to provide BIA the platform to collect it. On a quarterly basis, NamUs is providing the BIA with updated NamUs data on the number of American Indian and Alaska Native missing persons, unidentified persons, and unclaimed person cases. The most current reports showing aggregate data are being made available to our participants today, and you can download those documents as provided on the screen. NamUs also provides free forensic and analytic services, such as locating and acquiring fingerprint records that can be used for examination, searches, and comparisons. We can also assist with locating and acquiring dental records for comparisons, and we can provide free testing of unidentified remains and family record samples. And finally, we offer local, regional, and online training about NamUs and the services we provide. And all of these services are at no cost. NamUs is also in the process of creating a new victim services division that will connect families of missing persons to much-needed resources. The Victim Services Division is currently developing a victim notification protocol as well as publications and outreach materials to support families whose loved ones have gone missing or been found deceased. The division also plans to develop a peer-to-peer network where families provide support to one another. In the coming months, the NamUs Victim Service Division staff will be conducting outreach to tribal stakeholders and organizations to get their input on these services and protocols, as well as to coordinate services. Amongst the many things I've already talked about, NamUs staff also plan and hold missing person day events, typically at the community level or city. In some cases, it might be at the state level. But it's an opportunity for families and community members to come together to learn about what is happening with their case, or they can come and report a missing person. This year, we'll be holding a Missing Persons Day event during the Department of Justice's Office on Violence Against Women Tribal Consultation, being held August 21st through the 22nd in New Buffalo, Michigan. Missing Person Day events provide an opportunity for NamUs staff to help families and friends of missing persons file a missing person report with law enforcement if not done previously, provide assistance with the entry of case information or take additional or updated information for specific cases, assist with the collection of family reference samples, and most importantly, connect families with counselors and other services. And finally, for the sake of time, I will briefly mention some ongoing research and analytic work that the NamUs team is doing in an effort to improve operations and services. The NamUs research and analytics units are taking a closer look at NamUs data such as trends in the circumstances of cases, the types of violence experienced, time to case resolution, best investigative practices, and case completeness and information quality that will inform future system enhancements and services. So for those of you listening today, I encourage you to register with NamUs, where anyone can register and search cases. I will note that there are different degrees of access because there are law enforcement case-sensitive data that cannot be viewed by the public. But regardless, to register public viewers needs only provide basic information, including contact information, so that our NamUs staff can respond to case entries. And should anyone need additional information or clarification, please do not hesitate to contact me. And I knew I was going to go over my allotted 10 minutes, and so I had provided some questions, and I know we probably won't have time to go over them. But one of the things that we really want to do as far as partnering with you all in the future is, given what you've learned about NamUs today or prior to today, how do you recommend that we market or disseminate information about the system and the many programs, available free services, and resources? And with that, I'll turn that over.
Okay, so we have the polls open. Oh, we don't have the polls open. Okay. Just kidding. But if there's any questions, please message us and we will make sure to get that to you. And I know that there's, I believe, another, I know NAMUS is partnering also with the Urban Indian Health Institute. So I know that there's a lot going on there, and thank you all for your work on that.
Thank you.
All right, so sorry, Christine. I'm trying to get the polling going, but unfortunately, it is giving me a little bit of trouble here. Okay, here we go.
Given what you've learned about NAMUS today, how do you recommend that we market or disseminate information about the system and the program's many available services?
We will leave this poll question up and move it over to the side here for a little bit in the interest of time. But I also want to alert folks to, on the right-hand side, we do have the final PowerPoint presentation as well as a number of handouts that Christine has provided.
All right, thank you. Our next presenter is the Department of Housing and Urban Development.
Hi, everybody. Judd here.
I apologize, Judd. We skipped over Sherry Ann. I'm sorry. So our next presenter is Sherry Ann Moore with the Department of Justice, Tribal Affairs Office of Violence Against Women.
Thank you. Thank you. I want to thank Jeannie for the introduction, and thank you, Francis and Bertha, for coordinating this important virtual discussion. It's very important and timely for lots of reasons. In my role as the Deputy Director of the Tribal Affairs Division in OVW, I provide federal leadership for the tribes in developing the nation's capacity to specifically address and reduce the crimes of sexual assault, domestic violence, intimate partner violence, stalking, and in certain cases and programs that we administer, sex trafficking through the implementation of the Violence Against Women Act, also known as VAWA. VAWA is our authorizing legislation and has actually established our office. It established my position as Deputy Director and provides the funding for the tribal programs, all the grant programs in OVW, but for the tribal programs and grants and training and technical assistance initiatives that we administer. In our office, we do several things, but the main things fall under the categories of grants program administration, special initiatives, training and technical assistance, and very importantly, the annual tribal consultation on violence against women that is conducted and required and mandated of the Attorney General. This falls into my responsibility, and Tina had mentioned this year we are hosting our tribal consultation August 21st and 22nd in New Buffalo, Michigan, co-hosted by the Pokagon Band of Potawatomi Indians. And prior to our consultation is we are co-hosting or hosting a pre-consultation event with the Office for Victims of Crime, who is hosting an all-day tribal consultation on the victim of crime funding. So this is the first time we are adding to our consultation, but I think with all the issues and concerns that have come up and are surrounding the VOCA funds and that have been brought forward by tribal leaders, it's very important and timely to add this to our consultation. So we have VOCA on the 20th and Violence Against Women 21st and 22nd, and the Missing Persons Day that Tina had mentioned, the 21st. Very much looking forward to partnering with Tina and her NIJ NAMUS team on that. But I want to specifically invite the urban Indian organizations to attend our event, not only this year, but going forward. It's open to your attendance. Come caucus with the tribal leaders, get involved in this conversation. I very much welcome it and would do everything that I can to involve the urban conversation with the tribes. We, as part of our consultation, we do 3 things: administer tribal funds and programs, enhance the safety of Indian women from the crimes that we address, and strengthen the federal response to violent crimes in partnership with the tribal leaders. What I wanted to focus my time and presentation on today is an initiative that I developed, bringing my prior background and experience working with urban Indian organizations. I remain dedicated and committed to that work and working with all of you, understand the issues and the challenges that you face. We are launching this year an initiative. The purpose area is titled Improving Responses for American Indian Alaska Native Populations that are residing within urban locations. And so we'll be awarding a tribal organization that has demonstrated experience related to this and working with the urban Indian organizations, including our Alaska Natives, and also bringing into the mix non-Indian organizations that are serving our urban Indian populations in the metropolitan service areas of the United States. And so through this project, we aim to address a high priority need that has actually been identified by tribal leaders through consultation, to also serve their tribal members who are residing in the urban areas to improve the responses to domestic violence and sexual assault against our people, no matter where they're living, on or off tribal lands. What we're expecting to achieve through this is to partner with the urban Indian organizations that are serving victims of DVSA, stalking, and intimate partner violence, provide training and technical assistance, plan for delivering culturally specific services, develop strategies for incorporating culture activities to address this, conduct outreach, community education, build relationships, and bridge the gaps, and coordinate services with our system practitioners to hopefully provide and equip you more with enhancing your cultural services, not simply by replicating the mainstream models, but by creating culturally specific responses that incorporate tribal identity, values, and beliefs within your program design to be more effective for the people who are served. I think through this, urban Indian organizations will also have expanded resources to draw from to help respond to urban Indian population that are in need of these services. Many that have been described already today on the call. So we want to importantly involve non-Indian programs who are serving our tribal people to help them better understand how to work with our people and respect our cultures, with the goal of causing no additional harm and not to re-victimize our people. Helping to, like I said, bridge a gap, develop peer relationships and partnerships that will help to build the capacity of our urban Indian organizations to coordinate and access services with other tribal-specific programs and non-Indian partners. We're going to develop webinars on certain topics, provide on-site sessions at your urban Indian organization site, and training for you to receive the support and problem solving and guidance and strategies and building culturally specific program capacity that you identify is needed, something that is born from you and comes from you and not developed from the federal side out. So we will also develop and deliver a 2-day National Institute that will be designed to meet the needs of the urban Indian programs so that you have time and space to explore topics, network with the other organizations, and have more in-depth conversation and develop hands-on tools for building your capacity to operate your programs. And some our key partners in this effort are our OVW-funded tribal coalitions, which we have 18 funded coalitions across the nation. And I provided Mirtha with a document to share with all of you that lists all of our coalitions and a summary of what they do, where they're located, a map of where they're located, and also a link to their website so you can get their contact information and reach out. But through this project, we will bring all of you together, including Nikui and OUHP from IHS. It's to come. I'm very excited about it, and very much looking forward to working with all of you in this effort. We have 5 other grant programs that we manage also, and we have some other tribal TA initiatives that we're launching this year for data collection. We're developing a sexual assault online training certification, working to bring that into our tribal colleges and universities for our people who are to train victim specialists in Indian country and the tribal communities where they live. We'll be having national tribal men gathering to increase the involvement of tribal men and boys in the work that we do. And also we funded a sex trafficking, missing or murdered Indigenous women in our tribal communities conference as well, to increase the knowledge and capacity to address sex trafficking in our Indian communities and in our tribal communities. So I would absolutely love to see all of the urban Indian programs begin attending our events, getting involved in the work that we do, and becoming an active partner with us. And I think this initiative that we'll be launching this October will be the beginnings of that. And thanks again for coordinating this call, and I'm hoping it's also the beginning of a great collaboration with all the organizations on this call going forward. I did provide a question for you. Again,
Sherry Ann, thank you so much for your advocacy. We have the questions open. We've had the questions open. Sherry Ann, this is Francis. We've had the questions open while you were presenting, and so I know we're a bit behind. But if anybody wants to reach out to Sherry Ann, we'll be sure to connect her. And thank you so much, Sherry Ann, for all of your advocacy and your inclusion in urban Indian organizations.
Absolutely, Francis. I do want to say that I will be reaching out to you to get contact information so that we can make sure the urban Indian organizations are receiving our communication directly. So I'll have my staff reach out and work with you on that.
Thank you so much, Sherry, and I appreciate it. The next presenter is from the Department of Housing and Urban Development. Jed, thank you. You're next.
No problem. I'm happy to be here, and thanks for inviting me. This is Jad Atala with HUD. I work in the Office of Native American Programs. I'm a director here. I know we're going way over time, so I'm going to keep my remarks really, really brief. Hopefully you guys can hear me okay. The main thing I want to do today is just give everybody a quick overview on a handful of programs that we have that touch on all of the issues we talked about today for missing and murdered Indigenous women. Listening to all the presenters today, housing was mentioned multiple times in terms of needed resources to address some of these incredibly critical problems. And I can tell you that we have multiple programs that provide a lot of resources to potentially address these issues. We'll go back just for a second. So we're the Office of Native American Programs. We serve all federally recognized tribes and some state-recognized tribes. We have a bunch of programs. In terms of this particular area, I would say the block grants that we have are probably our primary resource that we use to help address housing and supportive services and health issues that murdered or missing Indigenous women and homeless Indigenous women and victims of domestic violence could be suffering from. So our big flagship program is called the Indian Housing Block Grant Program. This is a program that gets funded every single year by Congress. It gets funded at around $650 million. So this is the primary affordable housing program that the federal government has targeting Native American communities. The way this works is HUD runs a formula and makes annual grants to Indian tribes and Indian housing authorities across the country. And because of principles of self-determination the tribes themselves get to decide how to use this money. So there's a lot of flexibility at the local level for them to assess their needs and use these resources that we give them to meet those needs of their communities. But there's a very long menu of things that they can do with this annual block grant funding, and some of the things, the money is primarily used for housing construction and rehabilitation, but that kind of housing construction and rehabilitation can be very much targeted towards missing Indigenous women, victims of domestic violence, victims of human trafficking, very much can be tailored to those populations. Another big thing that can be done with this money is rental assistance, so voucher-style assistance. If you have a woman who's potentially a victim of human trafficking or a victim of domestic violence or homeless, what often happens is you see our Indian tribes and Indian housing authorities providing that victim with a voucher in an urban setting to place her in an apartment, help her with her rental assistance in order to get her out of the situation that she's currently in. The money can also be used for homeless shelters to actually build and operate homeless shelters for these populations, and the money can also be used for all sorts of crime prevention and crime awareness campaigns and initiatives, all designed to address these issues. So our second biggest program is called the Indian Community Development Block Grant Program. This is a competitive program that tribes also apply for every single year, similar to the Indian Housing Block Grant Program, but it has a sort of a broader menu of things that tribes can do with this money, and again, they get to decide what to do with this money. Some of the things that they can do, also victims for shelters for victims of domestic violence, homeless, abused, and neglected children, the parents and single mothers of those children. Crime prevention, awareness, legal services is a big one. It's a big public service that is funded, and obviously when you're dealing with this kind of population, there's a need for both health and legal services, and so this money can be available for that. And there's a lot of partnerships between tribes and nonprofits to address these needs. We also do a lot of technical assistance in these particular areas, and we have a lot of flexibility. We don't get too much. We get about $7 million a year in technical assistance funding that we can sort of tailor towards the needs of our tribes. The last thing I want to touch on, and this is kind of maybe the most pertinent issue that's out there right now, we have a interesting demonstration program. My office is not doing it, but our partner office, the Office of Special Needs Assistance Program in HUD is administering this program. There is a NOFA that's out right now. We got $13 million that was transferred from DOJ's Office of Victim Crimes. The money is specifically targeting, it's supposed to go for housing and services for victims of human trafficking. And there is a tribal component to this program. This is the first time we're doing this. So we got $13 million from DOJ. We published a notice of funding availability just a couple of weeks ago. And so eligible applicants are a range of continuums of care, nonprofits, tribes, tribal organizations, urban Indian organizations, anybody who's a nonprofit or a government agency. There's a long list of eligible applicants that could collaborate and put together an application, and we will fund these awards. And the money can be used for, like I said, housing and also supportive services. Primarily, the money will be used for building shelters, providing rental assistance to victims of human trafficking, shelters for victims of human trafficking, and then supportive services, both health and other supportive services. So that's sort of our big pitch right now. Applications are due on October 30th, and what I'll do is I will add a link to the NOFA in the comment box here. That's sort of our big one that's out right now, and I encourage you all to look into that as a possible funding opportunity. And that's it for me.
Thank you, Jad, so much. So there is, I know I've spoken to HUD before, and Esther, who is from Seattle Indian Health Board, is, I know they've been trying to develop some housing, and if you can note in the chat, they are these resources are, it seems like they're only available on tribal land. Is there anything that's available that's in urban settings?
No, so all of these resources can use well, just to be clear. So our two block grants provide assistance to tribes, but tribes aren't permitted to operate fairly.
Jad, you're breaking up real bad. Sorry.
I'm sorry. So tribes can operate outside their tribal areas. So these
Urban nonprofits.
Yeah, they can partner with urban nonprofit organizations, Indian urban health organizations. And the most recent demonstration programs are lab programs. That's going to be primarily across the country, but it's certainly to get at urban because funding is going to go that will collaborate, including urban Indian health organizations that work with their I would say encourage all each out to both together an application, kind of like a consortium get at victims of human trafficking that may be native and in urban settings. Get at.
Jad, so you're breaking up a bit. So I will connect with you directly to make sure that the questions get to you and we can get some answers going for folks. Because I know that a lot of us are having trouble hearing you, and I know the representative has a question as well. We can try to see if we can hear you, but if not, I think we'll just have to do it electronically. But Representative Kanish-Poden asked, how quickly are funds available to be accessed for HUD? Oh, and Chad just posted the link for the NOFA. Thank you.
Thank you. So the two block grant programs that I mentioned, they're available through local tribes. You would connect with your local tribe depending on where you operate, and see if they have available resources that they can sub-grant to you or provide to you to help you with your work. The program, the demonstration program that we just mentioned that's specifically targeting victims of trafficking, applications are due October 30th, so we'll probably take a couple of months to rate and rank applications and then make awards, and then money will be available shortly after that, so probably in the winter of 2020.
Okay, thank you, Jad, and I'd like to follow up with you to get some more information to make sure that our programs can access that. And I know there's been some challenges, so it's great to have this discussion, and thank you for being on today. And so at this time, if there's other questions, please ask. This is our open dialogue, and so you can ask questions to Jad or any issues that you all are having. And you can use the chat box. You can also speak on the phone. I know that we're over time, about 11 minutes, so we won't take up too much time, but it is really important to make sure that our programs, that folks understand what all the great work our programs do and the gaps.
So on this slide, you should see one question from HUD. What resources do you need from HUD to fill critical service gaps and prevent the risk factors leading to MMIW in your community? And then any final feedback that you all would like to share. And please feel free to unmute your phones. You can use the chat box, comment boxes, or this polling option as well.
Esther, do you want to address that question? I don't know if you have the ability on the phone, but. All right, does anyone else have any questions? I know Rose is still on the line, Jeannie, all of our presenters are still on, so you can ask questions or comments on any of these presentations.
This is Jeannie from the Administration for Native Americans. I just want to thank everybody that participated today on the phone and YouTube and on chat. We will compile all the comments that we've had questions and dialogue on, and those we haven't had the opportunity to answer yet. It is very valuable and very important information. So I just thank you for those of you that are working on this issue and in our urban areas. And just to let you know, we will be looking at each comment and working with Francis on how we can assess them and really continue to respond and work on addressing this important issue in the urban areas with our urban relatives. So I have to sign off, and I apologize, but again, I hope this is one of many conversations that we have virtually and in person, and let's keep the momentum going, keep the people engaged, and work together on this. So I apologize, I have to sign off, and again, I thank you for all who participated.
Yes, thank you so much. There are emails being posted on the chat. My email is up there if you need any help with coordination or any of the events from today. We will be posting this tomorrow. It'll be on our website, and we'll, please look out for that. And if there are no other questions, thank you so much to our presenters. I think we've learned a lot about not only the services that are provided, but the needs of services for our programs. And this is just the beginning of many other dialogues. So thank you all for participating today and staying with us throughout, and have a good night.
Thank you.
Thank you all from Minnesota.
Thank you.
Thank you, guys.